Hello and welcome back to the ACL TV. This video was created from an article on our health website. After watching, please ensure you like, share, and subscribe. I'll drop the link to the article in the description box. See you soon.
Welcome to the Explainer. Today, we're putting on our detective hats and becoming medical detectives. You know, we usually think of our nails as just a canvas for polish, or maybe simply something to trim and forget about. But what if I told you that they're actually quiet body messengers? Seriously, they are perfectly positioned to reveal some really early signals about what's going on deep inside your body. Okay, let's dive into this. I want you to literally look at your hands right now while watching this explainer. Go ahead, flip them over. Have you looked closely at your nails today? And I mean really closely. Because those little shields on your fingertips, they might just be trying to tell you a secret about your overall health. Section 1, the baseline, the ideal healthy nail. Now, what's really interesting about this slide is that before we can start spotting the clues, we need to establish a baseline. What does an ideal healthy nail actually look like? Well, a healthy nail is smooth, it's firm, and it has this slightly pinkish hue because the healthy nail bed is showing right through it. Your nails grow from a part of the skin called the nail matrix. It's hidden just under your cuticle, and it produces a hard protein called keratin. You'd probably assume these little shields are completely dry, but surprisingly, a healthy nail is actually made up of 15 to 25% water. It requires super delicate balance. Anything that disrupts that moisture or messes with your body's ability to produce sufficient keratin is going to change exactly how that nail grows. Section 2, Clue Category 1, Decoding Nail Colors. As medical detectives, this is where we really start paying attention. When your body experiences changes in blood circulation, nutrition, or is fighting an underlying illness, it can drastically alter your nail hues. These quiet messengers can tell us so much. A red tint can point to simple inflammation or sometimes even heart disease. White might indicate liver issues like low albumin or perhaps anemia. Yellow is super common for fungal infections, but it can also point to chronic lung conditions, literally known as yellow nail syndrome. And if you notice a blue tint, that's a major clue for poor oxygen levels, which is often linked to respiratory issues, heart disease, or Raynaud's phenomenon. But there's one specific color change we really need to highlight, and that's melanocia. Basically, this is when you develop black or dark nails caused by a buildup of pigments. Sure, it can totally just be from a simple bruise if you accidentally slammed your finger in a door. But listen closely to this part. If a dark nail or a dark stripe appears and you have absolutely no history of an injury, this can indicate melanoma, a serious type of skin cancer. If you see that, it requires immediate medical attention. No exceptions. Section 3, Clue Category 2, Texture and Shape Changes. Let's move to and see how this builds, shifting our focus from colors to the actual physical deformations of the nail. Do a quick check of your hands again. If your nails are brittle or peeling, honestly, it might just be from aging, overexposure to water, or using harsh chemicals, but it can also signal iron or vitamin B deficiencies. Now, do you notice any tiny dents or pitting? It kind of looks like the surface of a golf ball. That's actually an early sign of autoimmune conditions like psoriasis or eczema. And thickened nails can indicate anything from a really stubborn fungal infection to peripheral artery or lung diseases. It's just absolutely fascinating how a lack of vitamins or a systemic disease shows up right there at our fingertip. Then we have drastic shape changes, like cheilonesia. That's the medical term for spoon-shaped nails that actually curve inward. I mean, literally looking like they could hold a little drop of water. This deformation is often a direct reflection of what's happening with your blood and nutrient flow, specifically pointing to iron deficiency anemia, heart disease, or hypothyroidism. It's your body's way of saying, hey, we're lacking some crucial supplies here. Another major physical clue is something called Bowes lines. These are deep horizontal ridges running right across the nail. You can think of them like a chronological record of trauma. They physically impede normal nail growth and usually pop up after your body goes through something major. We're talking severe illnesses like pneumonia, extreme nutritional deficiencies, or even from chemotherapy treatments. Your body essentially hits the pause button on nail growth because it has to fight a much bigger battle. And this brilliantly illustrates the difference between what's perfectly normal and what's an actual red flag. Because let's be real, we definitely don't want to panic over every little bump. Harmless signs include those small white spots from a minor injury or brittle vertical ridges that just naturally happen as we age. Totally normal. But the warning signs? Those are things like a single dark stripe spreading underneath the nail bed or sudden spreading color changes that happen for absolutely no apparent reason. Section 4. The final verdict. When to see a doctor. So, the crucial point is knowing when it's time to stop investigating on your own. While everyday habits cause a ton of nail changes, specific clues really do require a professional eye. You need to call for medical backup if you spot spreading dark streaks underneath the nail, severe thickening and crumbling, or if the nail is completely separating from the bed. Watch out for sudden color changes like blue, black, or white, clubbed, or spoon shapes, and definitely any persistent pain or swelling around the nail area. Those are clear red flags that warrant a doctor ruling out any underlying heart, liver, lung, or autoimmune issues.
As we wrap up, I'm going to leave you with this question. What quiet messages is your body trying to send you right now? Your nails, they're so much more than just a beauty routine. They are a brilliant, real-time window into your health. Keep an eye on them, stay curious, and please never ignore what your body is trying to tell you.
Please subscribe.